Hello, everyone. This is Dr. Edward Eckert. I am the CEO and founder of Hormonify, which is a important company in the field of hormone replacement therapy. We established our protocols in the 1990s and 2000s when nobody was talking about hormones. Now everybody's talking about hormone replacement therapy. We set up an institute that studied hormone therapy for about 10 years, and we established our protocols based on that research. We also have over 1 million patient months of experience, mostly with women. I would say 70% women and 30% males. Today, we're going to focus on the 30%. And if you are a woman watching this, don't go away because it may help you understand your behavior and situations that occur in your relationship with your men in your life. So that I would still hang out because I'm going to give you some revelations, some understandings that I learned over the years with experience that deals with tens of thousands of men. And so I would like to keep an overview of what it is that you can get from this, as well as specific male complaints and issues that you're going to address. So I have some questions that were raised in our previous podcasts and also on our Facebook group, which is entitled Bioidentical Hormone Replacement Therapy, which is run by Robin, who is our coordinator, who will, and the place there as people raise questions. And so we gleaned a lot of those from you guys so that we can help you in this complicated area of medical care. The reason I say complicated is because there are so many companies that come and go that are a lot of times scams that basically give you what you can get prescription-wise and over-the-counter product, and they give you something that they want to sell. For example, now tirzepatide or Ozempic, that they sell you because you want to lose weight without dealing with the underlying cause of why your weight gain is significant. For example, we've discussed before the importance of the adrenal gland, DHEA and cortisol in the manifestation of weight gain. We've established estrogen levels that are satisfactory to assist you in reducing your weight gain in your midsection. All of those are not addressed by just here. For $2.99, you get this injection. We send it to you. We have our quote doctors review your file and send it to you. Most of those are scams because as soon as you finish, you're going to gain it back because you never dealt with the underlying etiology of your particular, for example, weight gain. So we're going to go ahead and broaden the conversation from testosterone, which is what is out there, to the issues surrounding the aging of men, especially when it has to do with not only testosterone, also adrenal gland deficiencies, as well as metabolic disorder relating to insulin resistance and prediabetes. So what I have experienced is that I have seen men in their 20s who have severe testosterone adrenal gland failure. A lot of it is congenital, the syndromes that are related to hypothalamic hypogonadism, which is left undiagnosed by most primary care doctors, and they need the testosterone because their levels are almost zero. I have seen patients who are very young who have been told that they're psychologically impaired, and finally they come to us. We evaluate them objectively. We don't make any judgmental decisions. And so I have a slew of patients, hundreds of them in that age group, unbeknownst. I have people who are 90 years old who are also replaced with testosterone because osteoporosis is reduced with adequate testosterone levels. As we age, we also have muscle wasting. Muscle wasting is when, as you age, you just lose your muscle mass. It's a big deal in patients who are over 70. It's a very significant thing that happens. So again, testosterone therapy is indicated, as well as adrenal support and nutritional support. In our practice, we get a complete nutritional assay of the important minerals, antioxidants, and omegas that are required because your body needs the nutritional components to build up what it is that we need to build up. Basic, which is ignored by 95% of the practitioners out there. So when we do that, we have patients come in. Sometimes they have 5 to 10 actual objective deficiencies of these products. And unless they're fixed, you're going to be running against the clock. You're fighting against the body's needs. And that's secondary to our food supply. We're not going to get into that today, but the food supply issue is very significant. Okay. We're not getting the nutrients in our food, hence supplements come in. There's quality supplements and there's crap. Most of the stuff online is crap. There's nothing in there. If you look at the labels, you see that it's just something they say is in there, I have one example, for example, 7-keto DHEA. It doesn't say how many milligrams of that is in it, but if you look on the back, it's mixed in with magnesium and calcium, and all of a sudden it's 800 milligrams, but it never says how much 7-keto DHEA is in the product because there's probably hardly anything. And they're paying a lot of money because it has a label, 7-keto. Plus, people don't understand in this supplement business, there are grades of product. For example, CoQ10. You can get a cheap CoQ10 and it'll have no biological activity whatsoever. Tested, they buy it in bulk, they put them in capsules, they sell it to you, and you think you're getting a good deal. You get what you pay for. So as what my question sometimes people have is, well, I have signs and symptoms of low testosterone, low energy, fatigue, midsection weight gain, low sex drive, moodiness, depression. And they come to me and say, I went to X doctor or X clinic and he put me on testosterone. I still didn't feel better. Very common. So proper evaluation, like anything else in medicine, is necessary. It takes the intellectual understanding of the processes to do that. And I would say 95% of the practitioners do not have it. They were never trained. They didn't do the research. They don't have the ability to think outside the box and figure out what it is causing the problem. Yes, testosterone is definitely important. So, and we see about 50 patients a day, about 20, 25 men per day. So over the last 30 years, we have seen, you can count it up, how many patients. So we have the experience. And I'll tell you, especially the women out there, is that women go through serious hormone changes. Our society has an extra sort of interest in dealing with that, the women to women syndrome, where, men don't understand women. And basically most of these companies out there that do that are scammers because they don't understand the processes either. All they do is give a estrogen patch with a progesterone pill at night. They don't understand that progesterone takes longer than, it needs to be longer than 10 hours in the body to do effectual change. And estrogen patch has very variable absorption. They don't deal with testosterone. They don't deal with adrenal gland function. They deal with nutritional concepts. They don't deal with the psychological aspects of what it is that you have to deal with. So for the men out there, you need to know if you are looking at your life and these things are changing, your relationship issue is dysfunctioning. All of the things I just mentioned apply to men as well. And if men don't feel good about themselves, it could be not just testosterone that's low. It could be that because you've gained weight in the midsection, you don't feel good about yourself. You do have an ability to change that with testosterone, but it's not going to stay unless you fix all the things that cause the problem, including the genetic propensity for you to be carbohydrate or sugar intolerant. The conversion of our nutritional status from the 1940s to today is that we shifted from protein-based to carbohydrate-based. And a lot of people, especially Northern European descent, cannot tolerate carbohydrates whatsoever. I consider it, in my own terminology, a carbohydrate allergy. Some people are allergic to tomatoes. Well, they don't eat tomatoes. But if you look at carbohydrates and sugar as an allergy, then you stay away from that. Obviously, you're going to be much healthier. And a lot of that has to do with how your body responds to the exposure to the poison, in your case, which is going to be sugars. People don't realize fruit is a very bad sugar, fructose. A lot of the GMO is to increase the sweetness of fruit, which then gives you much more sugar. And even though fruit may be having some value in some cases, especially if it is not grown in a large corporate farm, if it's grown in the backyard, but most food sources have been depleted of their vitamins and minerals. So what we try to do is go to the basics. Now, let's talk a little bit more about the next. What are the signs or symptoms of low testosterone? Now, when I say low testosterone, I'm referring to that whole complex of adrenal gland dysfunction, sometimes thyroid, but very rare, obesity, secondary to the abnormal carbohydrate metabolism, which is really rising insulin level in the face of exposure to glucose. So what are they? Well, we mentioned a lot. Just a little note about testosterone and the relationship to heart disease, because that's right away what people come and tell me. Every day I get a patient who tells me their doctor told them not to take testosterone because it increases heart disease. Well, unfortunately, the doctors who say that have not kept up with the literature and the research. In 2023, it was called a Traverse study, which absolutely proved beyond a shadow of a doubt, a huge study, that not only does testosterone replacement not increase heart disease, a deficiency of testosterone increases your risk of heart disease. It makes perfect sense. Heart disease gets worse when you get older. One of the factors is a depletion of testosterone. All of that makes sense to me. So in relationship to heart disease, which is very important, when doctors tell you something, never, ever just agree and say, yes, doctor. Those days are over. These doctors, most of them know nothing. They are absolutely less reliable than an AI search on ChatGPT. Trust me on that. I had a patient, like I said, and all I did was put in for the patient. I said, does testosterone increase heart disease? And I showed him while he was with his wife. Right there, it came up. The study came up. Everything came up. Took me literally 20 seconds. So what I'm trying to do is you should do the research and then you come to us and we will sort it out for you and individualize the therapy. Dosaging is extremely complicated. It has to do with body mass, age, symptoms, and genetics. So I need to know all of that. We do most of our work through either a computer technology, which is HIPAA approved, which is called secure video, or we do in person, or we do by phone. So thus the structure that makes it very easy. So the signs and symptoms of, we'll call it that syndrome related to low testosterone, mostly people come low energy, fatigue, midsection, body fat accumulation, not sexual dysfunction. That's on the list, but low down, because that's what presents first. Your adrenal gland burns out. They go to clinics, and this is something you need to understand, especially women out there with testosterone therapy as well. They give way too much. And that suppresses your adrenal gland function, overwhelms your body, and long-term creates not only serious complications and side effects, it does not resolve the problem because a lot of it has to do with adrenal gland function that maintains energy and carbohydrate metabolism. Big mistake. Then they tell you, oh, it's okay to have high testosterone, especially for men. No, it's not. We monitor the testosterone level because testosterone converts in everyone to estrogen. Too much estrogen in men is not good unless you want to transition to female. That's your business. We don't do that here. You need to go somewhere else. We don't transition men. However, we have patients who have very high testosterone levels coming from pellet therapy mainly, and estrogen level off the roof, sky high. So then what these places do, in my experience, is that they put you on an anti-estrogen without really monitoring your estrogen because they know it can increase estrogen, but they want to tell you that you are now in female levels of estrogen. See, this kind of deceit, this kind of game that they play is intellectually curious, but it's not good for you. Don't play the game. Question them. Go online. The ideal level of estradiol, for example, for men is 20 to 40. I'll even take 50. Because if you reduce estrogen to 0, less than 20, it does reduce your sexual appetite, your sexual drive. So you got to be a little cautious of knocking down the estrogen down to 0. That's not necessary. Just like in women with breast cancer, same thing. These doctors, these oncologists especially, knock you down to 0. You go through severe menopausal symptoms. And not only that, you have no sex drive. And you have basically depression. You have symptoms of fatigue because estrogen does have some role in maintaining good energy level. So that's a good thing, but it has to be only at the right levels, specifically monitored by someone who knows. These doctors who just give you the medications and then see you in 3 months is more dangerous than I think than helps. Because again, a lot of the side effects we see from this therapy is metabolic. It changes your biochemistry. I believe very strongly that there is something called body wisdom. I've done this for 40 years, and I am very impressed with how little I know. And yet these doctors come out of residency, they're 2 years out, they will become hormone experts, and I watch their videos. I sometimes laugh, which is not funny, how little they know and how stupid they sound. Yet to them, they are the key to the answer for your hormone therapies. They have no experience. They take a 3-hour course and they get certified by some drug related or drug supported research facility, and they get a certificate and they're an expert. 40 years of doing this, and I will tell you, I still know hardly anything, how complicated it is. But what I do have is excellent outcomes. That is what you pay money for, is the outcome, not to just say, here, give me testosterone. All these clinics that are sprouting up, I've been here doing this a long time. They come and go. It's a seasonal thing. They go out of business. They all reopen with another LLC. And yet why? Because patients don't get good results. Most of those reviews you read on Google are paid for. They're not real. I'm just telling you right now. We keep all our bad reviews right there on our website because all of our reviews that are excellent, 96% are excellent, is because they're real. In fact, most of the patients who write bad reviews are not even our patients. It's probably our competitors writing reviews. We try to check to see if the patient's, our patient. We can't find it. We have very young men who have not only testosterone deficiency, but also adrenal gland burnout from the lack of testosterone. So there's a feedback mechanism, especially with the stress of cortisol. It depletes the adrenal glands. We have to fix that as well. So we mentioned that already. So why are millions of men walking around with undiagnosed testosterone deficiency? Fear. Doctors, especially family practice, have been trained 20 years ago, 30 years ago, with the information that testosterone therapy does two things which it doesn't. It increases heart disease, we mentioned that already. Also, it increases prostatic cancer. That's as ridiculous as saying estrogen causes breast cancer. It doesn't. What testosterone does in relation to prostatic cancer is that testosterone does not increase the cancer rate or the stage. It's converted to estrogen, which stimulates benign prostatic hypertrophy, which is swelling of the prostate. But the cancer that is seen in prostates is almost all related to a virus called HPV, human papillomavirus. I went to a conference as an advisor in Washington to the government, try to establish criteria for whether or not men who are having intercourse with women of HPV should be tested. And the only way to prove that men have HPV is doing a prostatic biopsy. We evaluated all the options, including costs. It was decided that insurance companies should not be mandated by government to pay for those biopsies because the return is going to be so low because almost all, 96%, have HPV in their prostate. So what? Does that mean that everyone with HPV is going to get prostatic cancer? No, it does not. So therefore, to make the diagnosis to confirm prostatic cancer by doing HPV biopsies on men who have been exposed to HPV is not valid. What's valid is to assume, unless you were married to one woman your whole life, had sex with one woman your whole life, and so with her, that is not your situation, you can assume you have HPV. Your immune system, which your adrenal gland is important to, will prevent you from getting and developing breast cancer, especially out of the prostate. In the prostate, if you do autopsy studies on men over 75, almost all have prostatic cancer cells in their prostate related to chronic HPV exposure. People don't know that. That's an important information. So that's blown off the wall. So when you look at the heart disease issue and the prostatic cancer issue, now we can mention also benign prostatic hypertrophy, which occurs in every single male. Is it increased by testosterone therapy? Again, I mentioned that before, but I'll say it again to reiterate the fact that no, testosterone is not the problem. It is the estrogen. So we monitor the estrogen. And if we have to give you anti-estrogen to keep it within the ideal range, your risk of benign prostatic hypertrophy not only doesn't go up, it actually goes down. And also we advise patients to eliminate the estrogenic foods that stimulate benign prostatic hypertrophy. They're not measurable. They're not human. They are animal estrogens that are put into the food supply that stimulates not only breast cancer cell, but also prostatic hypertrophy. Makes the prostate grow. So another thing that we notice is that people send us their lab results and on the Hormonify group. And what does this mean? Or they come in and they say, my family doctor told me, or my urologist told me my testosterone is normal, but I have all these symptoms. Of course, they don't check the adrenal gland, they don't check the estrogen level, they just get testosterone levels and they say it's normal. Well, there's a normal range that we have for men, and that normal range includes all the people with low testosterone. That's how crazy this is. Why? Why doesn't it change? Why doesn't it get modified? Because there is a very strong influence from insurance companies not to allow testosterone therapy to be given to men. It's becoming much better in the last 2-3 years. But before that, in order for insurance companies to pay for not only testosterone, but also the visits related to low T, is that you needed 2 levels below normal before the government allows, if it's Medicare, and private insurance will allow payment. That's how it was for 15 years of our practice. We had to write letters. We had to show it. And they came back and said, look at the normal range. It's normal. Even though a male should have a level of, let's say total testosterone of cows, and it's 420. Normal range is about less than 300 out of that. So let's say it's normal range. You're not going to pay for it. Now that has been shown to be totally untrue. They didn't change the levels again because the influence, the forces that produce medical results, especially quote normal is now getting better in real life. Insurance companies are not requiring that letter anymore. Once in a while we get that letter. Okay. But most of the time this was because you guys complained. The insurance companies had to then hear your complaints. So it's a grassroots operation in moving these insurance companies to even allow payment. Now we belong to a federal registry that we are allowed to prescribe a controlled substance like testosterone through the federal registry, which is online, monitored by the DEA to make sure there's no abuse. And it's covered by every single insurance company, that we deal with. And it is easy because we can prescribe it to your pharmacy near your home with a click of a mouse. Every single pharmacy is registered, and therefore we can get it done, and the insurance company will cover it. You may have a copay, you may have a deductible, but it's actually extremely better. The government has got involved, has streamlined the system so that you, no matter where you are, we have patients in every state but one, that you can get your testosterone covered. Now, why, when you go to the clinic down the street in Waukegan, Wisconsin, why is it not covered? Because the doctor, if there is a doctor, nurse practitioner most likely, is not allowed to prescribe the controlled substance according to federal guidelines. So they do not get approval. They don't tell you that. But the reality is if you're paying for your testosterone and you have insurance, something is wrong. You need to look at that. And don't believe that testosterone is not covered anymore. It absolutely is. And so we look at the next level. Is adrenal gland supplementation covered? The answer is no. Because they're still at that point where I believe it should be covered because it's a fundamental metabolic disorder that is crucial. Again, there is movement. It's slow when you deal with any government regulations, agencies, or whether or not you deal with something like the pharmacy. It's very slow, very difficult. Usually takes litigation somewhere to move these people. So you need someone like me who can read the levels and say, this is what it should be to alleviate your symptoms. That's the key. That's something for example, when I get a new patient, the lab work comes back, first thing I ask them is, so what do you think? And they look, well, I don't know. I don't know. It looks all normal to me. I said, yes, that's exactly what the doctors say as well, who don't know anything. It looks normal. On the other hand, you go to the clinics that all they do is make money by giving you testosterone and charging you $150 a bottle, is that they say, oh, everything is abnormal. Here it is. We're going to make you feel better. And they give you way too much because they think in the olden days, men were looking for this Arnold Schwarzenegger sort of look, that they give you high dose of steroids and they build you up and you think you're more masculine. And in reality, they will not only reduce your ability of your own body to produce testosterone, but also it really affects negatively your adrenal gland. So you end up with shrunken testicles, inability to have an erection, and I'm sure those people are not very happy. So you got to be careful about that aspect. Now, we do have some people who have a history of testosterone or steroid abuse. They get in their gyms, the black market stuff. They don't even know what's in it, but they do it. And they come in, and a lot of them have very, very low levels of testosterone. They could be 30, 40, and 50. That is really less now as our patient population is getting more educated in the dangers of doing your own therapy with testosterone or other steroid blasts, anabolic steroids that you're getting in the gym from some guy. So how does testosterone or how does the adrenal gland function affect a male's desire for sexual activity and his performance? Very good question. The answer in a nutshell is that it's one of the major factors, but not the only factor. So if you have a man who comes in, let's say different age, let's say 50, who has erectile dysfunction, is on antihypertensive medicine, is 50 pounds overweight, who has a fasting insulin level of 17, which is elevated, has an adrenal gland function almost zero. There's a lot of factors that need to be corrected before we can say it's his testosterone that's causing his erectile dysfunction. Even if his testosterone is normal. I have patients coming in with those, and they're normal in my view, what they should be. I don't treat them. I treat all the other aspects of it. I give them supplementation to enhance the own body's ability to convert dihydroepiandrosterone to testosterone. Those therapies have been around for thousands of years. You go online, you can put it in there, and they got 50 companies that are selling you this stuff. Trouble is, you don't know the dosaging of what has to happen for it to be effective. So you get this stuff, you spend $100, and basically you're getting nothing because the dosing is too low. These combination products that have 16 things in them, yeah, they've all been proven to be helpful, but at such low dosaging, you're wasting your money. But who wouldn't know that? You see, so again, in the area of supplementation, there's a lot of scamming going on by the internet companies. I would say rarely do I find the product that I review online because patients say, I'm taking this. I'll look online and see. So by Amazon, I look at the label and I look at it. Rarely do I find a product that is anything more than BS. Rarely. Stay away from the internet in purchasing. Use the internet for information. So how does it affect libido? Well, if you correct all the problems, most men's sexual function will return within 2 months. It takes that long for the body to assimilate testosterone, fix the adrenal gland, help with the issues of insulin resistance. And I would say 90% of men are better. We have other products that we give the men that are not, because a lot of it has to do with blood flow as well. So there's a neurologic component to it, but a lot of the blood flow issues, listen up, is related to chronic elevated blood sugar. Blood sugars elevate the level of inflammation, vasculitis, and also inflammation of the nerves, neuritis, that causes a lot of symptoms of frank diabetes. But in the pre-diabetic state, people are developing issues like low energy, erectile dysfunction, which is vascular in origin. Yes, testosterone can help, but then we also work on the blood sugar issue because that is integral in getting good results. Remember, Hormonify gets patients when we get good results. We don't get patients when we spend millions of dollars in marketing. This is to teach you what we do differently. It's not basically anything more. We are an educational facility. And if you go to our website, hormonify.com, you'll see we have tons of stuff on there. And you should research it yourself. Do not believe any doctor, including you, because you should do your own research, take charge of your health care. I say it all the time to my patients. I'm here as your counselor, as an advisor. I have 40 years experience. I think I know something, but I definitely don't know everything. But I also definitely know how you need to approach your health care. But at least what we're telling you is true. So being truth seekers, whoever's out there and you listen to this video and you lasted this long, truth is the key. If you're not a truth seeker, go somewhere else. We don't live in a fantasy world here. We live in the real world. These clinics, these companies that are coming into the business are all there to just make money and rip you off. Every single day I see these cases that come to me, complete scam or 90% scam. And they market, they advertise, they spend their money in marketing, just like a lot of pharmaceutical companies. They tell you something about something that they've researched, but it's not the issue at hand. So yes, if you want to become more educated in this field, do your own research, then call me or come to me. If you have a doctor that says stupid things, like because you have a history of heart disease, XYZ, shouldn't make testosterone, have the doctor call me. Give him my website. Educate your doctor if he's a nice person. Most of the time, I tell them to leave him, because if they're that stupid in this area, they're probably stupid in every area. Okay? It's an indicator that they're not keeping up. All right? So you got to be careful about these doctors. That's the only way they're going to learn. And tell them, I'm not going to you because you told me something that in 2023, the study came out, the Traverse study, that says absolutely opposite of what you said. Why didn't you tell me that study existed so I can research it? So, for example, that's important. Now, in the male levels, especially relates to testosterone, why family doctors have been telling millions of men not to be on testosterone therapy, aside from the heart disease, false risk, is because they don't know how to do it. There's not a lot of money in it for them. They have to do a lot of work to get to where we are today. It took me years of research. They don't want to do it. They want to see patients 2 minutes. Next, here's a prescription. Next, they don't want to sit there and explain to you all the risks and benefits. Our visits with patients at least last 30 minutes, one in the initial visit, to explain all the things. But most of our patients come to us, they already know all this because they've been to our website, they've done their research, and we sit down, I start talking to them, say, I already know that. I just want my labs checked. I want you to evaluate my labs and let's get going. Mental clarity and testosterone. Men require not only in their lives and their jobs, to be in control of their mental processes. Clarity or foggy thinking, lack of clarity, is a very common complaint among men who come to me. Now, it's a multifactorial issue in general, but no question, testosterone deficiency enhances the inability of the mind to think clearly. And I think it's just as important for women as it is for men, but in my experience, that's more of a presenting symptom in men. They're just saying, I can't think clearly. And they're worried, and they worry too much about things that they're trying to do in their lives, and they just can't get to that place of problem solving. And so, interestingly enough, when I see my follow-up patients, it's usually a very cordial visit, and they say, I can think again. Now, the clarity of thought, it deals with many factors, and I can't really say for sure, but a lot of it has to do with the sugar metabolism abnormality that we fix. A lot of it is nutritional that we fix. A lot of it is testosterone. A lot of it is adrenal glands. So notice we're kind of like putting into a framework that you cannot just give testosterone and expect good results. It doesn't happen. There is no question that overdose of testosterone increases male aggression. It also, by the way, increases female aggression. So it's not a male or female issue. That's because especially the pellet, gives you way too much testosterone. And yes, there's no question that both male and female experience bouts of aggression that is definitely related to the overdose of testosterone. Normal levels of testosterone, in my view, does not increase those kind of problems. In fact, reduce mood disorders associated with hormone deficiency. So you're more stable, you're nicer, you're more relaxed, you sleep better. All those things enhance your quality of life. So if it's overdosed, no question, you have mood disorders. If it's not, it seems to work much better. So let me see here. I covered that already. Sleep issues, definitely. Now, if you evaluate sleep disorders and you go to a sleep lab, I'd say the studies I've read, 90% of people have sleep apnea. Now, is that the cause of your sleep disorder, or are there other factors involved? For men, yes, no question. Sleep apnea, especially if you're obese, increases your risk and may be a factor. And yes, sometimes you have to get a CPAP machine. There's no question. But the vast majority is hormonal, metabolic, or just chronic stress. Basically, some people have PTSD that wakes them up in the middle of the night. But no question, testosterone is one of the factors, but not a major factor. It is definitely a factor. But sleep apnea is diagnosed because that's where they make their money. So people have periods of time when they don't breathe, especially the OB. Sometimes it's mild, sometimes it's severe, but they don't look at their hormone levels. These sleep labs should know, especially for men, testosterone deficiency causes sleep disorders. Period. So they don't look at that. So they don't even look at it, so how are they going to know? Oh, if they look at it, they get the lab work and say, oh, look, it's normal. There you go again. So we got a whole area called sleep pathology that is not being properly diagnosed because they're not even looking at the hormonal aspects of sleep disorders. There's no question, and whether or not you consider yourself an alcoholic or not is not the issue. Alcohol, drop by drop, affects your metabolism in a very negative way. Period. There is nothing that anyone can say to me that proves that alcohol is good for you. I know that the wine industry comes up with, especially red wine with resveratrol, you have to drink 3 bottles a day to get the resveratrol you need to make an effect. But nonetheless, that being said, there is nothing that alcohol has, nothing that is good for you. Now, I understand the role of alcohol in our social life. However, alcohol does deplete your ability to process hormones, both men and women. It also is tremendously bad in terms of elevating your fasting insulin level, which causes more of the pre-diabetic conditions that we see, as well as midsection fat deposition. So, regardless of what the alcohol is coming from, alcohol drop by drop is a net negative. Now, some people have a affection for alcohol because they're basically self-medicating themselves for anxiety disorders arising out of post-traumatic stress disorder. So we try to isolate those patients and refer those patients for proper therapy. But in general, alcohol addiction is definitely a negative as far as hormone production. We do have some people who admit that they are addicted to alcohol and their hormones, especially men, are extremely depleted. Adrenal gland deficiency, extremely high, and also testosterone deficiency. Most men I speak to are referred to me by their wives who are our patients. They have a conversation, the intimacy issue is raised, and more or less, the guys are pretty cool about it. But it's very difficult for most men, for example, to go to their wives and say, I really think I need to be evaluated because that admits there's something wrong with them. And us men have a problem with that. We have a problem admitting that there may be something wrong with us. I think men are worse than that than women. The healthcare distribution in this country, I think, is 70% female, 30% men. We tend not to go to the doctor. We also tend not to deal with the intimate aspects of our lives with our doctors. We just don't go. That's the fact. So, if you're one of those men who really have a difficult time talking to your spouse or to your partner about the issues you're having, fine. You don't have to. You can just call us. We'll take care of it. And then when you're doing better, then if your wife or girlfriend is having problems, then you'll refer them to us. We have that as well. So you make the step, educate yourself. We deal with this stuff every day. To me, it's not a big deal to talk about whatever it is. I've heard it 1,000 times. You're not going to tell me anything that I haven't heard at least 1,000 times. And that's what 40 years of experience does. You get exposed to something and you can do it just naturally. I try not to prepare for these podcasts because then it gets stiff and plastic. I just try to speak from my experience. And if you enjoy the style, let us know. We try our best to speak to the truth. And if you're a truth seeker out there and you want the truth, give us a call. We'll try to help you. If you have a problem with your doctor, have him or her call us. We educate doctors every day around the country. I think it's important because I think that doctors have become lazy or have become overwhelmed or have become cynical as to keeping up with what is current. And in this arena, it's a very big deal. It always has been a big deal. That's why I got involved with it. So be vigilant, do your own research, and give Hormonify a call or go on our website and put information down at info@hormonify.com, and we will return your call, answer your questions. We do a gratis pre-consult. We speak to you about your issues to make sure we can help you. So you have nothing to lose. I do that because I want to get to know my patients. And even though we have tens of thousands of them, I enjoy that contact, and you have nothing to lose. So I hope we're helpful, and enjoy your day.